These two are my audience. This is my mother, and this is my boyfriend Colton, and there's Buddy the dog. Okay, Buddy, I need you to move, sweetheart. Thank you. Good afternoon, and thank you guys for coming. This is my informative speech regarding emergency department use for admissions, and this is for my speech class, and this is by me, Mackenzie Wood. Do you remember during the peak of COVID when hospitals were overran, and they are still, but I believe people have begun to slowly understood when they really need to go to the emergency department? COVID has opened our eyes to the crucial medical conditions that need to be admitted only to the ER and not at urgent care, which uses the proper resources of the medical system. By the end of this presentation, I want the audience to understand the main purpose of the emergency department in hospitals and to recognize the qualifications to attend an ER for their treatment. I am a nurse, and before that, I have been a patient care technician, or also known as a certified nurse's aide, for 7 years, and I also was a family member that attended the emergency room, and I was a nurse in the emergency room. So I believe I am a credible resource to speak on this topic. For my thesis statement, the purpose of the ER is to triage patients that are experiencing life-threatening medical emergencies. Reasons for attending an ER is chest pain, motor vehicle accidents, burns, stroke symptoms, poison intake, severe falls, or oral medication outpatient treatment that previously failed. COVID-19 has impacted our medical system greatly, and citizens need to understand and realize the proper reasons to go to an ER versus a urgent care, and because this could cause our healthcare system to become more at risk more than it already is. The purpose of the emergency department is to treat critically ill patients to prevent cardiac arrest in patients that are preventing the signs of physiological instability. Altered consciousness was the most frequent reason for the admissions, 17%. It was followed by respiratory failure at 13% and tachycardia, which is a medical terminology for fast heart rate, at 11%. 51% of patients were admitted after cardiac arrest, and 66 patients died in the emergency room. And this source is from Fiera F. that was published in 2008 from an emergency room medical journal. Reasons to go to the ED. An audience, after this, I will be passing out my pie charts and my pictures to present the urgent care versus the emergency room admissions. Reasons to go to the emergency room are severe allergic reactions, severe animal or insect bites, especially ones that are poisonous, sudden blurring or loss of vision, stroke symptoms, high fever that is above 103, especially in kiddos, and then repeated, keyword repeated vomiting for suspected poisoning, or severe breaks, loss of limbs, or loss of consciousness. And reasons to go to an urgent care are seasonal allergies, insect bites or minor animal bites, pink eye, neck pain, mild fevers below 102, nausea, vomiting, symptoms that are on the onset in the beginning, or minor sprains and strains or breaks. Emergency rooms are for life-threatening medical issues. Urgent care can be used for non-emergent, less severe medical problems. Now that we spoke about the main reasons to go to an emergency department, I'm going to speak about how COVID-19 has affected the emergency departments and what to expect when you go to an ER. During the early pandemic period, the total number of US ED visits was 42% lower than during the same period that year, with the largest declines in kids. Health messages that reinforce the importance of immediately seeking care for symptoms of serious conditions such as a heart attack are needed, and to minimize COVID-19 transmissions risks and address public concerns about visiting the ED during the pandemic, the CDC recommends the continued use of virtual visits and triage to help lines for adherence to the CDC. And this source was from Harnett KP that was published in 2020 by a medical journal that was on the impact of COVID-19 pandemic in the emergency department visits. The emergency department visits are seldom planned, but when you arrive, typically a nurse will check your condition and determine if you need to be seen by a doctor immediately. Try to be patient if you need to wait, and be assured that you will be helped as soon as possible. Emergency departments use a system called triage, which means people are seen based on the seriousness of their condition. Remember, this is a stressful situation, but you are surrounded by professionals that are trained to help you. Being calm will help you communicate better with the doctors, nurses, and hospital staff. And this source was from MethodistHealthSystems.org that was published on 2021 on their website, and that was actually from my employer. In conclusion, I spoke about the purpose of an ED, reasons to go to the ED, and the effects on COVID-19 on the emergency department. To save money, time, and resources, I encourage you to think before you run to the emergency department for your healthcare issues, and hopefully this information will give you knowledge to do so. Why would you not want to save money with attending a urgent care and not put yourself or your family at risk for COVID-19? Use the correct resources and help your local nurses and medical system that has already been through a lot with COVID-19. We are strained and understaffed, and if I can educate at least a few people and help our healthcare system a little and clear up more room for emergency cases, it will create a positive outcome for our emergency departments. Thank you for watching, and you have a great day. Bye. And I'm going to hand out